I want to thank you. I want to thank Penn State College of Medicine and the Pennsylvania Psychiatric Institute for hosting us today to make this important announcement in the state's ongoing, continuing effort to fight the heroin and opioid epidemic. Today, we're announcing 4 $1 million grants to expand access to medication-assisted treatment for people suffering from the disease of addiction, substance use disorder. These grants will help people recover from their illness in their own communities through, as Erica pointed out, a hub and spoke network of healthcare providers. We know that medication-assisted treatment works, and these grants can go a long way to help right here in Pennsylvania at the Pennsylvania Psychiatric Institute. We've been working hard in every department, and today I'm pleased that the leaders of the Departments of Health, Human Services, and Drug and Alcohol programs are here. Teresa, Jen, and Dr. Rachel Levine. Together, these agencies, along with the Department of Aging Secretary Teresa Osborne, because a lot of our seniors are affected by the opioid epidemic, they secured a $26.5 million Cures Act grant from the federal government to support prevention, treatment, and recovery services to battle the epidemic that we're facing here. Today's announcement is on the heels of an announcement earlier this month of a $5.7 million Cures grant in Western Pennsylvania to UPMC for private medication-assisted treatment. In addition to Penn State, the other 3 $1 million grant recipients are Geisinger Health, Allegheny Health, and WellSpan in York County. Each of these grants will go a long way to link community-based treatment providers with a hub of support that can provide care focused on the individual. I've made fighting the opioid epidemic, this crisis, a top priority of my administration, and I will continue to work across the aisle to address this looming public, it's not looming anymore, it's a real public health issue. These grants are one of many initiatives underway and making a big difference here in Pennsylvania. We have provided, just to go through some of the list here, we've provided funding to implement 45 treatment centers, call them centers of excellence, throughout the Commonwealth, where we hope to treat, between the time the last one was open in February and the time we get to the end of that 12-month period by next February, 11,000 Pennsylvanians with substance use disorder. We've grown the number of drug take-back boxes to more than 700. We've destroyed more than 300,000 pounds of drugs. We've equipped law enforcement, first responders, and schools with the overdose reversing antidote naloxone, and recently announced $5 million in naloxone funding for 2017 and 18. This life-saving drug has reversed more than 4,000 heroin and opioid overdoses just since 2014. Dr. Levine, I think this is in the first week we were in office, issued a standing order, which is essentially a prescription written for every Pennsylvanian for naloxone. Any one of us can go to CVS and get a prescription, fill that prescription for naloxone. 90,000 physicians have conducted more than 1 million searches on the prescription drug monitoring program since it became operational in 2016. We've announced improved prescribing guidelines for the safe and effective use of opioids, including in sports medicine, for minors, for Pennsylvanians on Medicaid, as well as improved education for medical professionals on opioid prescribing. If you go to medical school, you're studying to be a GP, and you get to the point in your career one of your patients blows out her knee in a field hockey game. Thanks to what the medical schools are doing throughout Pennsylvania, that general practitioner is going to be in a position to actually treat her patient. We launched a 24/7 helpline for those who need immediate assistance with drug and alcohol programs so they can get into treatment and recovery. More than 15,000 Pennsylvanians have contacted the statewide helpline for assistance so far, and we know that having someone to talk to actually makes a difference. Someone is thinking about going into treatment, thinking about recovery. Because of expansion to more Pennsylvanians, Medicaid, we talk about the 700 and so thousand people who now have health insurance who didn't have it before. We have 125,000 people who are actually getting treatment for substance use disorder whose providers are getting reimbursed because of the expanded Medicaid. We've done all these things, but the fight is not yet over. With innovative programs made possible by these medication-assisted grants, and with strong leaders in Pennsylvania's aging health and health-related agencies, we're going to continue to do some more things. We need knowledge, we need understanding throughout Pennsylvania. We're going to continue to work to build that and to fight this epidemic. I know we Pennsylvanians can prevail in the long run. I'm really pleased to be here, pleased to be able to be partnering with the Pennsylvania Psychiatric Institute in combating this dreaded disease. So thank you for having me here, Dr. Hillmeyer. Anything else you want to say? Okay, we're all open for questions on topic. I'll do a gaggle if there's any question off topic away from the podium. Any questions on this?